Welcome, everyone, to our Sports Medicine Weekly podcast. My name is Steve Cashel. We've got a great guest on the line we'll be visiting with, Leanne Hulteen, a physical therapist with Athletico Physical Therapy. Talk all about their home therapy services. But first, a reminder, we thank all of our sponsors, including JRF Ortho. They partner with orthopedic surgeons to improve the quality of life of patients by enabling them to have an active life through the generous gift of cartilage and ligament transplantation. Please go to jrfortho.org to learn more. Sign up to be a tissue donor at donatelife.net. Again, our guest, Leanne Hulteen, physical therapist and with Athletico Physical Therapy. She does the home therapy services, among other things, and resource centers out of Oak Brook, Illinois. And Leanne, thanks so much for joining us here in our Sports Medicine Weekly podcast.
Good morning. Thank you for having me.
Appreciate it. So how long have you been with Athletico? And explain a little bit about what you do.
Sure. So I've been with Athletico since 2014. I have recently, actually in August of this year, Athletico started the home therapy service line. So I am currently managing that service line. We now have over 250 clinicians in the Chicagoland area participating in the program. And as of November, we have started offering the program in 9 of the states that we're in. So yeah, it's been a great program and very well received.
Good. Well, I know our listeners want to know, what is home therapy? Can you define that for us?
Sure. So home therapy is really just another way for patients to access therapy services through Athletico. So Athletico Home Therapy is really designed for patients that are medically stable and only have a need for therapy services, so physical therapy and occupational therapy in the home setting. So patients do not need to be homebound, and they shouldn't have, a need for nursing services. That would be more traditional home health. Our therapists can provide physical therapy and occupational therapy in the comfort of the home with lots of appointment options, and the service line, we offer home therapy 7 days a week.
Wow. So that's this isn't something virtual then. This is actually your clinicians going to people's homes, correct?
That is correct. Our clinicians are going to, the place where the patient needs care.
Wonderful. And home therapy is not home health, correct?
That is correct. So home health is like traditional home health is a multidisciplinary service line. So they offer, they do offer therapy services, but they also offer nursing, social work, sometimes a home health aide. Patients need to be homebound to receive home health services. And oftentimes it may be after a hospital stay, and just to make sure that, patients, their medical issues are addressed. So our program is definitely different than that. So our patients, are medically stable enough to come to the clinic, but, we're seeing them in the home instead.
Wow, that's very convenient. So what types of patients then benefit from your home therapy from Athletico?
Sure. So patients obviously recovering from surgery are ideal for the home therapy program. So sometimes, many surgeries are same-day surgeries. Patients get out of surgery pretty early and they come home. They have an assistive device that, they have to now utilize in the home setting, and that can be very challenging. But not only surgical patients are appropriate for this program, it's also, suited for patients that have concerns regarding COVID, or maybe a patient has, a high regard for privacy. Patients could have transportation challenges. And, it's a great option even for patients that just prefer the convenience of having a therapist come to their home.
Absolutely. No, I agree. And so what do patients, when they're thinking about using Athletico, Leanne, what do they need to prepare in their home? I mean, do they need to purchase any special equipment specifically for home therapy? Have an area in which to perform the physical therapy? Well, kind of paint a picture for us if you can
Sure,
for
sure.
what our patients may need to prepare for.
Sure. So, our therapists will call the patient before their upcoming session, and they'll give the patient a chance to ask questions. They'll set expectations for that visit to really kind of prepare them for what to expect, especially on that first visit. But as far as additional equipment, patients do not need to purchase any additional equipment. PTs and OTs are very creative when it comes to developing their plan of care, and they're even more so in the home setting. They oftentimes use, common household items such as, perhaps a gallon of milk for lifting activities. They may use a pillow or a cushion to have a patient stand on to address balance activities. There's ways that they can work with sit to stand and squatting using, different chairs of different heights. And they're making sure that they can go up and down the stairs safely, and they'll use those stairs to increase lower extremity strength. So they're very creative when it comes to utilizing the objects in the home, but therapists also may bring additional items from their clinic, depending on the needs of the patient.
Oh, that's great. So again, we're visiting with Leanne Hulteen, physical therapist. She runs the home therapy services for Athletico Physical Therapy, and this is just great that especially with COVID and some people that do not want to leave their home. Athletico launching the home therapy service line in August of 2020 in the Chicagoland market, and as of last November, as Leanne mentioned, they now offer home therapy services in 9 states, and they have over 250 clinicians from their clinics in the Chicagoland area participating in the program. So let's talk about when people and our listeners and possible patients, potential patients, preparing for their upcoming home therapy session. What should they think about?
So, one thing to remember for, patient safety is always, in the forefront. So, our clinicians will utilize the proper PPE and follow CDC guidelines for COVID mitigation. But we do ask that all patients wear a mask or face covering during the session, just like we would in the clinic setting. Our therapists will take temperatures prior to initiating treatment. And then we also ask that any family members that may be participating in the session or may be in the same room during that session, that they also wear a mask and practice social distancing. We do suggest that, if patients have animals in the home, that they secure those animals to make sure that they're not interfering with the treatment session. And that's one thing we don't have to worry about, obviously, in the clinic setting. But, we just want to make sure that, the room that we are performing most of the treatment session in is clear of too many things. So animals can sometimes interfere.
Okay, that's great. And I know patients and the listeners want to know, does a patient require a prescription from his or her doctor for these home therapy services?
So Illinois is now a direct access state for physical therapists. So in Illinois, patients do not need a prescription to start therapy in the home.
That's great. That's a big lift for patients and for Athletico, correctly?
Yeah, absolutely. So that's
great.
That's a nice, way to, to get the services rather quickly. So it decreases the barriers to get that care.
Okay, and then finally, again, visiting with Leanne Hulteen, Athletico Physical Therapy, talking about home therapy services here on Sports Medicine Weekly. How can a patient request therapy in the home?
So, there are several ways that a patient can request therapy, and they're very easy ways. Patients can access the home therapy page on Athletico's website, and they can request a home therapy visit. And really, they're entering some basic information, and we have technology that will actually match a patient with an available therapist in their area. So it's kind of like Uber matches passengers to drivers. So that's one way. The second way, if patients prefer to speak to a live person, they can call our 877-ATHLETICO number and press number 3 to speak to a member of our home therapy team. And they can always email the home therapy team at hometherapy@athletico.com. They can ask questions. They can request an appointment. They can send over their referral if they have a referral. So those are 3 really easy ways that they can request a home therapy visit.
Fantastic. Before we move on, we hope everyone has tried Karen Malkin's new protein brownie bar and superfood bars. Karen is a great sponsor here on Sports Medicine Weekly. Best tasting bars on the market, certified gluten-free, paleo, and no added sugar. Karen's protein brownie bars and superfood bars, available on Amazon and at KarenMalkin.com. One other question for you. How is this going now, Leanne, in your opinion? This is great because, boy, I think about so many different patients, whether COVID, the elderly, even for kids. A hockey player breaks his wrist. Maybe he can't get a ride into one of your facilities. So, your home therapy program can come to their home. How successful has it been so far?
Yeah, it's really taken off. I think part of it is, kind of the times, with COVID and the pandemic. It definitely, at the very beginning, I think people were hesitant to have a therapist come to the home, but I think, patients have wanted to, as the pandemic kind of progressed, patients wanted to avoid crowds. And so it really started to take off, especially because, therapy is a hands-on treatment. So we do a lot of exercise, but there's a lot of hands-on that you just can't always accomplish, via telehealth, although that's been a very successful program for us as well. But sometimes patients do need that hands-on. So we've really seen it take off. But, we have had requests. We started home therapy officially in August, but we have been doing home therapy periodically for quite a while. And we've noticed that, before we launched the program, we noticed that, this was becoming, more and more of a requested service. And there's been some changes in with traditional home health and the way that surgeons are, wanting to provide that nice, smooth continuity of care. And this is just another option that patients can access. And it really does provide a nice, smooth continuum of care, specifically when we get those patients to the next level of their rehab and getting them into the clinic setting. And oftentimes it's with the same therapist. So we're really finding that we're getting a lot of good feedback from our patients. Our clinicians are really learning a lot as far as, challenges that we may not see in the clinic setting initially. By treating the patient in the home, we are more aware of, maybe the patient doesn't have a great support system to help them follow up with their home exercise program, or maybe they have some architectural challenges in their home, that the therapist can keep that in mind when they get that patient to the next level of rehab in the clinic setting, that they may not have had, with other patients that didn't start out in with home therapy.
Great stuff, Leanne. I appreciate it. Well said. Really, thank you for joining us here on Sports Medicine Weekly. It's something I was not aware of, and Athletico did a great job on my shoulder following shoulder surgery a couple of years ago, and I did the dry needle And it was just tremendous. And Athletico is top notch. So I want to finish with this. We thank you as well. Athletico is one of our partners. What if the best way to treat your pain is to start with physical therapy? Same Athletico therapists who work with world-class athletes and professional dancers can transform your pain before it progresses to something worse. Schedule your free assessment at athletico.com. It all starts with Athletico. And then we learned today about their home therapy services. Leanne Holteen, our guest, she's out of the Oak Brook, Illinois office and center. So, Leanne, thanks so much for joining us here. Great job.
Thank you.
Continued success.
Thank you very much.
Thank you, Leanne. Take care. And that'll do it for this edition of our Sports Medicine Weekly podcast. Thanks, everybody. We'll talk with you again next time. I'm Steve Cashel. Take care.